Everyone, my name is Dr. Edward Yost. I'm an anesthesiologist and I'm up in New York. And I traveled from New York today to speak to you. And I think it's important that we understand that there's patients who are doctors like myself who also have Lyme disease. So I'd just like to read my testimony to you and ask you if you have any questions. And specifically, I would like to say that if anyone on this board had Lyme disease and was treated for a small amount of time by a doctor with antibiotics and began to feel better, and then that care was withdrawn, what would you do as you descended back into the abyss of Lyme disease, as you began to feel horrible again? So I find that unconscionable that we can give people a short term of antibiotics and then withdraw that care when they're feeling better. So I just want to know, if you experienced that, what would you do? You'd start seeing every doctor you knew what to do to provide you with more antibiotics. So I'm going to read my testimony now. Good morning, my name is Dr. Edward Yost. I'm a board-certified anesthesiologist, a member of the American Society of Anesthesiologists, International Spine Intervention Society, and the American Headache Society. And I come to speak to the legislature today not only as a physician, but representing those who, like me, suffer from Lyme disease. I received my Bachelor's of Science degree in chemistry from Long Island University in 1984. Shortly after I joined the United States Navy, I was in the United States Navy pilot, carrier-based, and served with the Armed Forces for 7 years, receiving an honorable discharge in 1991. I was then hired by American Airlines and operated Boeing 727, 757, 767 aircraft as a co-pilot and traveled throughout the world. It was during this time that I attended Columbia University. I got my post-baccalaureate pre-med program there. And in 1994, I began my training at Stony Brook University Medical School in Stony Brook, New York. During my second year of medical school, I discovered a tick on my scalp, and approximately 3 to 4 weeks later, I became ill with flu-like symptoms, shortness of breath, and general malaise. As a physician in training, I knew something was wrong, and I began to speak to the physicians who were around me in medical school. They had really nothing to offer. And over the next 5 years, with the accessibility that my career in aviation afforded me, I traveled to the esteemed Cleveland Clinic and to lesser-known areas of Europe with an attempt to find me a remedy for this mysterious chronic illness that was rapidly causing me to become debilitated. In total, I saw over 35 doctors, including specialists in internal medicine, infectious disease, chronic fatigue, cardiologists, rheumatologists, and neurologists, and I'm a doctor. Every physician I met dismissed my thoughts of having contracted Lyme disease, including 2 members of the IDSA that wrote the protocol for 21 days of antibiotic treatment. I saw 2 of those members on that board that wrote that damn protocol. Every physician I met dismissed my thoughts of having contracted Lyme disease. Although I initially presented with a tick bite and was suffering from joint pain and muscle aches and fatigue, and I was trained in medicine, I still had no diagnosis or a physician who was willing to listen to my concerns. As the obscure manifestations of the illness persisted, I began my descent into failing health. My illness was becoming more noticeable. I was having neurological symptoms. At the urging of a fellow pilot, I was informed about a Lyme literate physician here in your Commonwealth of Pennsylvania. With waning hope, I consulted with this doctor who examined and diagnosed me with Lyme disease, and quite frankly, he saved my life, and that's why I'm here today. He called me and asked me to testify. So I drove from New York because this doctor in your state saved my life. After circumnavigating the globe, it was here in Pennsylvania that I found what I had so desperately needed, a physician who was trained in the diagnosis and treatment of tick-borne illnesses. and was sensitive to those illnesses and understood them and made the diagnosis. I went everywhere in the world looking for a doctor. I ran up hundreds of thousands of dollars of medical costs. After years of long-term treatment, including antibiotics and antimalarials, I was able to improve my health, graduated medical school, became board certified in my specialty, and had a deeper understanding of medicine while being a better physician to my patients. However, because of the delay in my getting the proper treatment, I am left with the lingering effects of chronic Lyme disease. I truly believe my colleagues dismissed me because they were not properly trained to acknowledge tick-borne illnesses and their manifestations, or they opted to challenge the research finding that there is a chronic form of the disease. My personal experience demonstrates that further education is warranted to train physicians in the assessment, diagnosis, and treatment of tick-borne illnesses. Pennsylvania policy and lack of action regarding this policy discourages current physicians from properly treating patients with Lyme disease throughout the Commonwealth of Pennsylvania, and inhibits doctors from other states, including myself, from providing services to the infirmed within your borders. Ignoring the problem with the disease will not make it go away. Lack of treatment in the acute phase will only lead to a chronic condition. The abandonment and rejection I received by the medical community over an extended period of years contributed to me becoming a chronically ill individual. People suffering with chronic illnesses are no longer in possession of the fruits of their existence. Their lives are not their own. They are enslaved under the conditions determined by the disease and those by directing their medical care, specifically the doctors and the insurance companies that have diametrically opposed views on medical treatment. We can either acknowledge that the patient is chronic and allow them the proper course of therapy, or dismiss them and essentially abandon them or shuffle them from one physician to the next, as I was. In 1776, a group of legislators, including 5 doctors, affirmed the rights of the individual citizen in a community not far from here in this state. Now this legislature has the chance to protect those liberties again by defending the basic right of the patients. A good society is one that takes care of its sick. A good society is against alienation. A good society revolts against an unhinged life. The chronically ill are estranged from the constraints of those operating within our society who are restraining care. Doctors must be able to do their jobs and protect the patients who are seeking their care. I believe as we work towards awareness in Lyme disease and continuing research, history will prove that members of this legislature will have done the right thing here and now with benevolence, opening the dialogue on this major health threat through addressing the public policy and acting upon that policy on behalf of the public's best interest will be a momentous step forward for those suffering from Lyme disease.
Go ahead, you can begin your testimony.